Good day everyone, my name is Salvation S. Baltazar and I am from Group 1. We were assigned to report about the joints. So to begin with, we have here the goals: to distinguish the three classes of joints, describe the examples of each joint classes, and identify different types of motion in joints. The points in the skeleton where two or more bones join together is called articulations. Now let's see the classification of joints. First one is the fibrous joints. They are fibrous tissue tightly binds the articulating bones. Cartilaginous joints formed when a mass of cartilage joins a bone. Synovial joints, always freely movable, has a flexible joint capsule composed of ligaments and connective structures lined with synovial membrane. Let us identify the types of fibrous joints. The first one is the suture. This is a joint between two flat bones. The example here is the sagittal suture, as it is between the left and right parietal bones. The next one is syndesmosis. These bands are fibrous tissue that bind bones. The example here is the distal ends of the radius and the ulna. Type is the gymphosis. It is a fibrous membrane that connects each tooth to its socket in a Joe's alveolar process.
Good day everyone, we discussed today about the joint. One of the joint I discussed is all about the types of the cartilaginous joint. Number one is the synchondrosis. Synchondrosis is the hyaline cartilage connects bones. Cortical cartilage between ribs and sternum. Symphysis. Symphysis is the fibrocartilage forming joints. Symphysis pubis is joining right and left coccyx. Types of synovial joints: gliding or plane. Two flat surfaces slide past each other. Carpal bones. Hinge as in hinge door, two bones join so they can move in one plane only. Elbow. Ellipsoid oval condyle fit in an oval fossa allowing movement in two planes. Metatarsal phalanges of the foot. Other types of synovial joints. One of these is the pivot. Pivot also is called the rotary joint. One pivots on the axis of the other, allowing rotation at last end axis. Saddle. Two saddle shape process fit together, allowing movement in two planes. Cams, proximal phalanx and trapezium. Ball and socket. Ball fits in a round fossa, allowing unrestricted movement. Femur and acetabulum.
The ball and socket. The ball and socket joint is the champion of all joints. For the ball and socket, its structure is just like how it sounds, a ball inside of a socket. This simple and adduction, rotation, and circumduction, the two ball and socket joint of the body, are the hip and the shoulder. The hip has a deep socket which is give it stability but limits some range of motion. The shoulder joints has a shallower socket which is give it greater range of motion but takes away some stability. We have parts of synovial joint. First, articulating bone. Second, articulating cartilage, joint capsule, synovial membrane, synovial fluid, and the other one is synovial cavity. There are three joint movement, which is diarthrosis, ampiarthrosis, and synarthrosis. The coronal or frontal planes divide the body into front and back, also called dorsal and ventral or posterior and anterior section, and are X and Y planes.
Hi everyone, I am Joyce Agustin. So I am gonna tackle about the circular movements. Circumduction. It is move distal end of arm in a circle, making a cone-shaped sweep. Rotation. Move bone on its axis as if on a pivot or ankle. Circular movements has two circular movements, pronation and the supination. Pronation, rotating the forearm to palm facing downward. Supination, rotating the forearm to palm facing upward. Orthography. Orthography, radiographic examination. Radiographic examination of the soft tissue that form joints. Contrast medium, injected into the joints, coating the cartilage, ligaments, and soft structures. Arthrogram. Coated tissues clearly appears. Knee arthrogram, bursa, pillow made of synovial membrane and filled with synovial fluid. Meniscus, piece of cartilage shaped like a disc with curved surface. Articular cartilage. It is a cartilage coating on the articulating surfaces of bones. And these are the anatomy of the knee.
Let us try to answer some of the exercises on our laboratory manual. Let us identify the different types of motion that is shown in the picture. The first one here shows abduction because the arrow is pointing away. And then the second one is gonna be extension. The third one is abduction. The fourth one is flexion. Number 5 is adduction because we can see that the arrow is pointing inwards. And then the number 6 is flexion. Number 7 is also a flexion. Number 8 is a hyperextension. The number 9 figure is extension. And the last one is adduction. The arrow is also pointing inwards. Let us try to identify these different joints according to their classifications, whether it is fibrous, synovial, or cartilaginous joint. Number 1 is gliding joint. It is a synovial joint. Next one is synchondrosis. It is a cartilaginous joint. Next one is freely movable. It is a synovial joint. The next one is suture. It is a fibrous joint. The next one is gymphosis. It is also a fibrous joint. Next is saddle joint. It is considered as synovial joint. Hinge joint is also a synovial joint. Symphysis is a cartilaginous joint. And then mainly hyaline cartilage or fibrocartilage is a synovial joint. And then the last one is ellipsoid joint. It is considered as synovial joint.